Today we're going to be demonstrating how to give patient or resident foot care. And as always, the skill starts with a knock on the door.
Come in.
Hi, I'll be right with you. I just need to go wash my hands. As always, we're going to wash our hands before we do any patient care. To properly wash your hands, please see the video on hand washing. For right now, we're going to assume that I've already gone through that process. My hands are now clean, and I'm ready to go to work. Hi, how are you today?
I'm fine.
My name is Ms.Andrews. I'm going to be your PCT for today. Is it okay if I check your name down?
Sure.
Okay, Ms. Grant. I'm here to provide you with foot care. Is that okay if we do that now?
Sure.
Okay, I'm going to need to go get my supplies. In the meantime, I'm going to provide you with privacy. I am going to give you your call light in case you need anything.
Thank you.
I'm going to get my supplies and I'll be right back.
Thank you.
For this skill, we're going to cover our bedside table as we always do to gather our supplies. We're going to need a foot basin, two washcloths. I always like to take a couple of barriers with me. That can be a paper towel or any kind of thing that's disposable, but I take them with me just in case. Soap, a thermometer to check the temperature. I'm also going to give her two choices of lotion so that she has a preference, and a towel. The additional things that I'm going to need will be a garbage can, a stool for myself, and the dirty linen container. I'm going to go to the sink now. I'm going to run the warm water. I'm going to make sure it's not too hot. Remember not to overfill the basin because you don't want to spill it once their feet are inside. Hi, Ms. Grant. I'm also going to take a barrier to put down on the floor, so something that's nice and clean for my patient or my resident, so she doesn't have to put her feet down on the floor. Okay, Miss Grant, I'm just going to check this water temperature. And it is between 105 and 109 degrees, so it's safe. But I'd like you to just check it and make sure that it's okay for you.
Okay. Perfect.
Okay. Just place your feet in the basin. Doing okay today?
Mm-hmm.
Okay. I'm gonna wet my first rag. I'm gonna have control of all the ends of it. I'm going to soap. And I'm going to begin washing her first foot. I like to wash all the way up to the knee. I'm going to be paying very close attention to in between her toes to make sure that there's no cracks, there's no broken skin. And I'm going to rinse everything off. I'm going to take a clean washcloth with no soap on it now. Make sure I have control of all the ends, and I'm just going to rinse and make sure that I've rinsed all the soap off, especially in between her toes. Okay. So, I'm going to take her other foot out of the water and wash it. Again, washing in between the toes, making sure that I get all of them. Make sure that there's no breakage of skin anywhere, no sores, no cuts. That's especially important for diabetics because they don't heal well. If we do see any cuts or sores, we want to make sure that we report that to the nurse. Okay, I'm done with this one. My rinse cloth. Always make sure that the water continues to stay warm and does not get too soapy. If that should happen during the course of this skill, you will need to stop and change the water. I'm going to rinse. Okay, Ms. Grant, I'm going to just have you remove your feet from the water. I'm going to move this over. I'm going to have you come give them to me right up here. You okay?
Gosh, yes.
Going to make sure that she stays warm. Ms. Grant, I'd like to put a little lotion on your feet and your legs. Is that okay with you?
Sure.
Okay, I have two different types here. Which one would you prefer?
Scented.
The scented?
Mm-hmm.
First I'm going to dry and make sure that I dry all the water out from in between her toes because moisture can cause breakdown of skin. I'm going to put some lotion in my hand. I'm going to warm it in my hands. I'm going to start with long strokes. On the top of her feet. I can put a little bit down on her heel. I don't want to put too much on the bottom of her feet because I don't want it to become slippery, and we never ever put any in between the toes. That can stay and linger and cause skin breakdown. Now that I'm finished with the lotion, I'm just going to pat dry any excess lotion that there might be. And I'm going to have her replace this leg back down to the clean surface that I have there for the floor. And I'm going to go to the next leg. I'm going to dry it, make sure it's totally dry. Make sure it's dry in between her toes. I'm going to put some lotion in my hand again. Warm the lotion in my hands. Long strokes in one direction. Okay, again, no lotion in between the toes. I'm going to put some on the heel. I can put a little bit on the bottom of the foot, not too much. And then again, I am going to pat dry any excessive lotion. Okay, Ms. Grant, just place your leg down there for a moment. Okay, Miss Grant, I'm gonna replace your socks onto your feet. And I'm gonna replace your non-skid footwear. Okay. This. I just need to go and get rid of my supplies and I will return to you in a moment. In the meantime, you do have your call light and I'll be right back.
Okay.
Empty this water into the car. I'm gonna rinse it. Okay. Dry. We're gonna spray. And I'm gonna put this back where it goes. Then with my barriers, I'm just going to wipe off my lotion a little bit. Make sure everything is clean and dry. Put this back where they go. I'm going to replace this bedside table to our patient. Okay, Ms. Williams, I'm going to open up your privacy. We're all finished for today. I see you do have your call light. In the meantime, again, my name is Ms.Andrews. If there's anything else you need, please give me a call. Would you like your lights on or off?
Off.
Would you like your TV open or closed?
On.
Window open or closed?
Open.
Okay, I'll take care of that for you. Again, I'm Ms.Andrews. If you need me, please let me know. I'm now going to go wash my hands, and then I'm going to leave the room.